Hi, everyone, and thank you, Stefan, and good afternoon. I woke up this morning. I was actually in Rafah in Gaza in the UN office where my colleagues and I stay in something resembling safety while we assist Palestinians through the 14th month of these horrific atrocities in this terrible war. I say resembling safety because the brutal truth is that, nowhere is actually safe in Gaza. We've said this many times before. We've said it since the start. It remains true. And I think it may well be the most dangerous place on earth right now. You could be a mother of 6. You could be an injured person who's just been amputated in hospital, an aid worker, a small child, a Palestinian teacher, or an Israeli hostage. And dying hungry and in pain are frighteningly likely for you these days in Gaza. We're there to support over 2 million people who for more than 14 months have struggled to stay alive, to uphold their dignity and that of their families. Each day they try to secure the most basic necessities, food, shelter, and now quite literally attempting to just stay alive. But we're not allowed to do our jobs. Whether our response is impactful, as it should be, cannot continue to be measured in the number of trucks that reach Gaza, but in whether people are safe from hunger, rain, disease, and if they have access to proper and appropriate healthcare facilities, protection, and even to safe drinking water. These days, what manages to cross into Gaza and actually get to the people that it's supposed to get to is a mere trickle compared to what it used to be before the war and even in the first few months of this war. The opportunities for sustainable supplies are scarce, and the degree to which our operations in the Gaza Strip are supported by the Israeli authorities is almost zero. As the occupying power, it imposes blanket prohibitions on nearly everything. Commercial imports have been banned. Humanitarian equipment and supplies for Gaza are consistently blocked, and our own movements inside the Gaza Strip are most often denied. In most areas, people's mere presence is a defiance against military orders for forcible evacuation or displacement. The Israeli authorities and the military seem unwilling to open multiple access points at once, which is important for the amount of supplies that we have. And the main crossing for the southern Gaza, which has most of the people in the strip, Kerem Shalom, is exactly the place where criminals now stand ready to loot almost all of our convoys. This looting has become armed, it's become violent, and it's systematic. Time and again, drivers are assaulted, injured, hospitalized, and sometimes even killed. Even the warehouses of NGOs and the UN have now come under attack. We've tried speaking with those that target these convoys, as well as whole communities, but we are not able to solve the problem of the absence of rule of law at this point. It's just gotten too big for humanitarians to solve. We've called repeatedly for improvements, such as the prevention of cigarette smuggling, but it doesn't seem to be having any resonance. When we raise these things with Israeli authorities, they reject virtually every single practical solution that we table. They don't want to use border scanners to intercept cigarette smuggling. They continue to target the civilian police inside Gaza. We've talked about this in the past. They deny alternative routes for our supply convoys, which would let us reach people in bulk and sustainably. And they don't allow the importation of the private sector, which could reduce prices and discourage looting. Everything in Gaza, every single thing you bring on a truck is now high value. So this is something that really makes people want to take whatever is on the truck because either they need it or they're going to sell it to get money. On the occasions when our activities are allowed to move ahead by the Israeli forces, our operations face direct interference. They order us not to deliver fuel to certain locations, to generators in hospitals or to shelter sites, not to carry out parts of our planning that they disapprove of, and to operate only in the designated areas that do not have evacuation orders. From where we are in Gaza, it looks like the aid system has been weaponized. And as a result of this, what we can provide to people is only a fraction of what they truly need. Every day, as an aid worker in Gaza, you're forced to make horrible decisions. Should I let people die of starvation or of the cold? Do we bring in more food to ease hunger or more plastic sheets for some shelter from the rain at night? Do I cut back on hygiene supplies or do I bring in more painkillers for the sick and injured? What I can tell you is that people are exhausted. You can see it with your own eyes. You can see it when you look at them in the hospital, on the street, as you drive by them, when you meet them, when you talk to them. Famine is very likely already here. The Famine Review Committee 42 very long days ago called for immediate action within days, not weeks. Yet here we still are. And those who have survived so far are on the brink of an even greater disaster. As a humanitarian system, even we operate hand to mouth. Whatever we bring in, we have to distribute almost immediately. We don't have any reserves or buffer stocks left anymore. A very large percentage of the important emergency medical supplies are just at zero stock. What we bring in is never near enough. When Rafah crossing closed, when the operation began, we were able to continue for more than 3 weeks to respond without any new supplies coming in. Now, if we don't get supplies for 3 days, we don't have the ability to help anyone in Gaza. We can't go 3 days without fuel or food actually entering the Strip. Our humanitarian operations, especially in southern Gaza, are almost paralyzed because of this. In Gaza City, in northern Gaza, we can't support people because we don't have predictable accessibility between the south and the north. The Israeli corridor bisecting the Strip has been fortified to such a degree that it's not really a corridor anymore. It's a massive military no-go zone where not a single civilian structure remains intact. Everything has been flattened. And to reach Gaza City from the south, we have to cross this no-go zone, but we don't have predictable access through the Israeli checkpoints. They don't open enough, and there are massive amounts of time spent simply waiting for them to decide to open. And there's been a lot of talk about the besieged areas in North Gaza Governorate. It's been 75 days since military operations began there or intensified, and that's a near total siege for everyone that's there. We think there are between 30 to 50,000 people in the North Gaza Governorate that are remaining there and have not been forced to displace to Gaza City. We received chilling reports of mass casualties, unspeakable decimation of whole towns and communities and neighborhoods, and constant bombardment of shelters and hospitals. Movement is only allowed in one direction, out, and even that is not a secure movement. So far, tens of thousands have had to flee under bombing and shooting. For us, the access into this area has been choked off. Since the 6th of October, almost 150 requests or attempts to access the area have been denied by the Israeli forces. In exceptional circumstances, such as the ones for the 2 remaining medical facilities, we're allowed in. And we use that to bring in a trickle of supplies. Many of those supplies, when we plan these missions, are rejected by the Israeli forces. So we can say we're bringing in fuel and medicine and some food for the patients, and they will consistently remove the food or this or that. So they minimize what the objective of the mission is, how much we can bring and when we can bring it. We've managed a single food delivery to North Gaza, 2 trucks and 1 truck of water actually with them. And where we took these trucks, we actually then heard that the shelter, the UNRWA school that was being used was actually attacked and burnt down. We heard about another location where people were sheltering. And when we planned a supply mission there, the Israeli military denied our access. And then the location sheltering people were forcibly displaced to Gaza City. You know, I mean, as the humanitarian system, you heard Stefan earlier before me, we assist millions of people in other responses, and we have done so for decades. We can do the same in Gaza if one hand was not consistently tied behind their back. I think as journalists, we know that international press is banned from Gaza to enter and see what I'm describing firsthand. There's so many things that I wish you could see to tell the world what's happening. You know, children without shoes in the cold, running through garbage and mud next to plastic shelters just being swept away by storms and waves. Families living in stairwells of schools that, you know, we optimistically name as shelters or displacement sites. They're trying to sleep, to find privacy, they can't. And injured people, you know, who were hurt in their struggle just to take something off of passing aid trucks. I think there's 3 points that I want to finish with. The first is that, you know, we need to take a real look at some of the self-congratulations over aid entering the Gaza Strip these days, let alone the besieged areas. It's very little and it's very late. We see 100 requests rejected, and then we have, you know, 1 request actually allowed to go, and then congratulations about, you know, how it happens. And then after that, what we have is the UN and NGOs, hundreds of whom have been killed in this war, publicly mocked for not doing enough, for not trying hard enough to do something which we know very well how to do. And we have examples of doing it all over the world consistently. As humanitarians, we stand firm against being told where and how we should work in Gaza. We need to get to people wherever they are. We need to prove the impact of this response based on how people are doing and not the numbers of trucks or crossings. And we need to give them what they need. We are obligated in this, not just by a shared humanity, but the variety of mandates that the United Nations and NGOs have to meet people's different needs. Simply protect civilians and respect the laws of war, it's not enough. It's important, it's critical, and we've been doing it for 14 months with no avail, to no real impact. And I hope that member states can fulfill their obligations under international humanitarian law, use their leverage to ensure the protection of civilians, to enable adequate and timely aid to people that need it, and to bring about a ceasefire. We have to protect the civilians. We have to release the hostages. We need to see these atrocities end. And we need to see humanitarian workers be allowed to do their job. Thank you very much.
Thank you very much, Mr. Petropoulos. I'll now turn the floor over for questions. First question goes to Edith Lederer.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. You said that it looks like the aid system has been weaponized. Is this something you've discussed with the Israeli authorities? And what reasons do they give you for all of these denials?
Thank you very much. It's actually my privilege to be here with you today. So we discuss where aid will go and how much aid and what type of aid it is, who's in the car, what kind of car it is, with the Israeli forces every time that we notify them that we're moving somewhere. And most of the time it's denials or some kind of interference in what we bring. The reasons about the denials, what we hear is that for operational reasons, you cannot feed people in North Gaza time after time after time. The weaponization of aid is an inference that, if you have the North Gaza governorate, the northernmost governorate of the Strip, where you're not allowed to bring any food or water, but you're allowed to bring it south of that in Gaza City, and then people are moving south, you have to infer that there's the usage of the aid supply line or the aid delivery system, the last mile of aid, to move people around. And I think we heard it earlier in this briefing today that people have to be assisted and protected where they choose to stay. Civilians have a right to stay where they are, and all parties to the conflict have a responsibility to protect them and enable humanitarians to service their humanitarian needs wherever they are.
Deji?
Yes, Shudaji with China Central Television. It seemed to me that you have a lot to say on the current situation. But let me ask you, how do you feel when you get hundreds of denies of the entry of humanitarian deliveries into Gaza as a humanitarian worker here? And also, what is the prospect for the coming, let's say, coming month? Will this situation be changed soon?
It's a question that we ask ourselves very often. How do you keep going? How do you keep asking the same thing? I mean, I think it's a privilege to be a humanitarian worker in Gaza. There's not many of us international staff. Most of the work we do relies on our Palestinian colleagues, the thousands of humanitarian workers that were there before and are still there and doing most of the work. We take and derive a lot of optimism and hope from them. I think it's testament that we try day after day the same thing with the same result, because that's the right thing to do. I hope that there will be change, and that's the point that we make about member states leveraging everything they can to say the right things, to get the parties to the conflict to allow us to go where we need to go. But at this point, all we can do is ask. We as humanitarians cannot enforce. We have to be allowed to get to where people are. We know we can, and we have to be given the things with which to help them, whether that is medicine, whether that is a social worker, or someone that has to go and protect the child whose parents were blown up in an airstrike the night before.
So a follow-up, with UNRWA soon being banned by Israel, will the situation getting worse?
UNRWA is the bulk of the response. Millions of people are fed daily because of UNRWA's food supply line. More than 15,000 medical consultations every day in the primary healthcare system of Gaza are at UNRWA health points. Thousands of children are in temporary learning sites because of UNRWA. Stopping that is going to be a humanitarian catastrophe. And it's not only about whether that stoppage has to do with UNRWA, but it's about the thinking of what will that actually do to the people that need food and water and shelter. There's hundreds of sites that used to be schools that are now actually UNRWA sites that have upwards of 230,000 displaced people living in them. And, UNRWA makes sure that they have what they need every day. That's all going to go away. There's simply no way to replace that.